Welcome back, students. Now we're going to work on Chapter 16, Building Ophthalmology Terms. If you haven't already done so, go to page 346 in the third edition of the book and work through building ophthalmology terms on your own. Then we can come back here and see how you did. Aqueo is a combining form that means water. Aqueous means pertaining to. Blepharo is a combining form that means eyelid. Blepharoptosis is a drooping eyelid. Blepharoplasty is surgical repair of the eyelid. And blepharoplegia is eyelid paralysis. Choroidal means pertaining to the choroid layer. Choroiditis is choroid layer inflammation. Conjunctivitis is conjunctiva inflammation. Conjunctival means pertaining to the conjunctiva. A choriometer is an instrument for measuring the pupil. Choriometry is a process of measuring the pupil. Corneal means pertaining to the cornea. Cycloplegia is ciliary body paralysis. Cyclotomy is cutting into the ciliary body. A dacryolyth is a tear stone. Dacryorrhea is tear discharge. Iritis means inflammation of the iris. Iris paralysis is iridoplegia. Cutting into the iris is iridotomy. A keratometer is an instrument for measuring the cornea, and keratoplasty is the surgical repair of the cornea. Nasolacrimal means pertaining to the nose and tears. Intraocular means pertaining to within the eye. Oculomycosis is an abnormal condition of eye fungus. An ophthalmoscope is an instrument for visually examining the eye, and xerophthalmia is a dry eye condition. Opia is a suffix that means vision. Without half of vision is hemianopia. Optometry is the process of measuring vision. Phacomalacia is an abnormal softening of the lens. Phacolysis is to destroy the lens. Pupillary means pertaining to the pupil. Retina disease is retinopathy, and surgical fixation of the retina is retinopexy. Scleromalacia is an abnormal softening of the sclera, and scleritis is sclera inflammation. Tonometry is the process of measuring pressure. Vitreous means pertaining to glassy. All right, let's cover some ophthalmology vocabulary. Accommodation, abbreviated ACC, is the ability of the eye to adjust to variations in distance. Achromatopsia is a profound inability to see color from birth. It's also called color blindness. Amblyopia is the loss of vision not due to any disease. Not correctable with glasses, a person with amblyopia wears a patch over one eye to force the affected eye to work. This is commonly called a lazy eye. Astigmatism is the uneven bending of light rays caused by the irregular curvature of the cornea. The image is fuzzy and it can be corrected with cylindrical lenses. Cataract is when the lens becomes cloudy or opaque and it results in the whole vision field becoming blurry. The treatment is usually surgical removal of the cataract and replacement of the lens with an artificial lens. A color vision test uses multicolored charts like the one seen here to determine the ability of a patient to recognize color. And normal vision, you should be able to see the number 27 in this chart. A corneal abrasion is the scraping injury of the outer layer of the cornea. A cryoextraction is a procedure used to remove a lens with a cataract using an extremely cold probe. Diabetic retinopathy is the development of small hemorrhages and edema in the retina as a result of diabetes mellitus. Dark spots appear in the visual field. Laser surgery may be necessary for treatment. Fluorescein is a bright green fluorescent dye dropped onto the surface of the eyeball to highlight corneal abrasions. Fluorescein angiography is a procedure using intravenous fluorescein to examine the movement of blood through the blood vessels of the eye. Glaucoma is a condition resulting from an increase in intraocular pressure, which, if left untreated, can result in atrophy of the optic nerve and blindness. The patient notices that vision becomes blurry around the edges, and treatment is usually with medication and surgery. Hyperopia is a visual condition in which a person can see things in the distance but has trouble reading material at a close range. It's also known as farsightedness, and it's corrected with converging or biconvex lenses. An intraocular lens implant replaces a defective natural lens with an artificial lens following a cataract extraction. Laser-assisted in situ keratomileusis, or LASIK, is a correction of myopia using laser surgery to remove minute slices of the corneal tissue. Laser retinal photocoagulation uses a laser to make pinpoint scars to stabilize a detached or torn retina. Macular degeneration is degeneration or deterioration of the macula lutea of the retina. The patient notices loss of vision in the center of the visual field. Myopia, abbreviated MY, is a visual condition in which a person can see things at a close range, but distance vision is blurred. This is also known as nearsightedness, and it is corrected with diverging or biconcave lenses. Photophobia is excessive sensitivity to light leading to avoidance. It's not a psychological fear of light. PRK, photorefractive keratectomy, is the use of a laser to reshape the cornea to improve visual acuity. Radial keratotomy is a surgery with spoke-like incisions in the cornea to flatten it, and this is done to correct nearsightedness. And a refractive error is a defect in the ability of the eye to bend light rays to focus an image properly on the fovea centralis. And this occurs in myopia and hyperopia. Retinal detachment occurs when the retina becomes separated from the choroid layer. This separation seriously damages blood vessels and nerves and can result in blindness. A slit lamp microscope is an instrument used in ophthalmology for examining the conjunctiva, cornea, iris, and lens, and it consists of a microscope combined with a light source that can be narrowed into a slit. The Snellen eye chart is a chart used for testing visual acuity. It contains letters of varying sizes and is shown from a distance of 20 feet. The average person who can read at this distance is said to have 20/20 vision. Strabismus is the weakness of the external eye muscle that results in the eyes looking in different directions at the same time. It can be corrected with glasses, eye exercises, or surgery, and it's commonly called cross-eyed if the eye is turned towards the nose. Strabotomy is an incision into the eye muscles to correct strabismus. And a stye is a small purulent infection of the sebaceous gland of the eyelid. It's usually treated with a hot compress or surgical incision and drainage. It's also called hordeolum. A visual acuity test, abbreviated VA, is a measurement of the sharpness of a patient's vision. It's usually a Snellen chart is used for this test, and the patient identifies letters from a distance of 20 feet. The term 20/20 vision means the person is able to see at 20 feet what a person with normal vision would be expected to see at 20 feet. Terms such as 20 to 100 indicate a person's degree of myopia. That is, he or she must be 20 feet away from an object to see it when a person with normal vision could see the object from 200 feet away. Okay, here are some common ophthalmology abbreviations. ACC, accommodation, a sting for astigmatism, C.GL, correction with glasses, CYL, cylindrical lens, D, diopter, which stands for lens strength, DO, doctor of osteopathic medicine, ECCE is an extracapsular cataract extraction, ICCE is an intracapsular cataract cryo-extraction, IOL, intraocular lens, IOP, intraocular pressure, LASIK, and MD, doctor of medicine. MY for myopia, OD, doctor of optometry, For ophthalmology, PERRLA, pupils equal, round, reactive to light and accommodation, PRK. REM, rapid eye movement, RK. Radiokeratotomy, S.GL, without correction or glasses. VA, visual acuity, and VF, visual field. Okay, now we're on chapter 17, which is building otorhinolaryngology terms. So if you haven't already done so, you should go to chapter 17, page 370, and work through building the terms, and then come back here to figure out how you did. Adenoidectomy is the surgical removal of an adenoid. Adenoid inflammation is adenoiditis. Audiology is the study of hearing. Audiometry is the process of measuring hearing. Auditory means pertaining to hearing. Aural, pertaining to the ear. Cochlear, pertaining to the cochlea. Laryngoplegia is larynx paralysis. Laryngospasm is an involuntary muscle contraction of the larynx. Myringectomy is the surgical removal of the eardrum. Myringosclerosis is hardening of the eardrum. Nasogastric means pertaining to the nose and the stomach. Nasopharyngeal means pertaining to the nose and the throat. Anosmia means without a sense of smell. Otic means pertaining to the ear. Otoscope is an instrument for viewing the ear. A pharyngospasm is an involuntary muscle contraction of the pharynx. Pharyngotomy is cutting into the pharynx. Aphonia means without voice. Dysphonia means abnormal or difficult voice. Rhinorrhea is discharge from the nose. And rhinomycosis is abnormal condition of nose fungus. Tonsillar means pertaining to the tonsils. Tonsillectomy is surgical removal of the tonsils. Tracheostenosis means narrowing of the trachea, and endotracheal means pertaining to within the trachea. Tympanometry is the process of measuring eardrum movement. Tympanorhexis is eardrum rupture. Okay, here is some otorhinolaryngology vocabulary. Acoustic neuroma is a benign tumor of the cochlear nerve sheath, and symptoms include tinnitus, headache, vertigo, and progressive hearing loss. American Sign Language, abbreviated ASL, is not a nonverbal method of communicating in which the hands and fingers are used to indicate words and concepts. It's used by people with hearing impairment and/or speech impairment. Antiemetic drugs are medications used to treat the nausea that's associated with vertigo. A cochlear implant that you see here is a hearing device surgically placed under the skin behind the ear that converts sound signals into magnetic impulses that stimulate the cochlear nerve. Croup is an acute respiratory condition in infants and children, and symptoms include a barking cough. Deafness is the inability to hear or having some degree of hearing impairment. A decongestant is a medication used to reduce nasal and sinus stuffiness and congestion. Diphtheria is a bacterial upper respiratory infection that's characterized by the formation of a thick, membranous film across the throat and a high mortality rate. However, it's now a lot more uncommon due to the diphtheria, pertussis, and tetanus vaccine. An endotracheal, or ET, intubation is inserting a tube through the mouth and into the trachea, and this creates an open upper respiratory airway. Epistaxis is a nosebleed. A falling test is a group of tests to evaluate balance and equilibrium. For example, balance on one foot, heel to toe walking, walking forward with the eyes closed. The test is repeated with the patient's eyes closed, swaying, and falling with the eyes closed can indicate an equilibrium malfunction. A hearing aid is a device used by persons with impaired hearing to amplify sound. It's also called an amplification device. Meniere's disease is an acute or chronic inner ear condition that can lead to progressive hearing loss. Symptoms include vertigo, hearing loss, and tinnitus. A nasal cannula is a two-pronged plastic device for delivering oxygen directly into the nose. One prong is inserted into each nares. Otitis externa, or OE, is an external ear infection caused by a fungus, also called otomycosis, and the common name for that is swimmer's ear. Otitis interna is inflammation of the inner ear, and it can affect both hearing and equilibrium. It's also called an inner ear infection. Otitis media, or abbreviated OM, is a bacterial or viral infection of the middle ear. It's common in children, often preceded by an upper respiratory infection during which pathogens move from the pharynx to the middle ear through the auditory tube. This is commonly referred to as a middle ear infection. Pertussis is a bacterial infection of the upper respiratory tract. Again, it's uncommon now due to the DPT vaccine. It's also commonly called whooping cough due to the whoop sound made when coughing. A pressure equalizing tube, also called a PE tube, is a small tube surgically placed in the eardrum, and it assists in draining trapped fluid and equalizing pressure between the middle ear and the atmosphere. A Rhine and Weber tuning fork test is a test to assess both function of the cochlear nerve and the ability of the ear structures to conduct sound waves to the inner ear. The physician holds a tuning fork against or near the bones on the side of the patient's head, as you can see here. Tinnitus is ringing in the ears. Vertigo is a sensation of spinning or whirling around. It's incorrectly used to mean dizziness. Wax emulsifiers are medication used to soften earwax and prevent its buildup in the outer ear canal. Here are some common otorhinolaryngology abbreviations. ASL for American Sign Language, DPT for diphtheria, pertussis, tetanus, EENT, eyes, ears, nose, and throat, ENT, ears, nose, and throat, or otorhinolaryngology, ET, endotracheal, HEENT, head, eyes, ears, nose, and throat, OE, otitis externa, OM, otitis media, OTO, otology. PE tube, which is a pressure equalizing tube, TNA, tonsillectomy and adenoidectomy, URI, upper respiratory infection.